We're in a new phase of the pandemic. The public health emergency is over in many states, and with it, some of the changes that allowed for the expanded use of telehealth are gone too. According to the Alliance for Connected Care, a telehealth industry trade group, Michigan is one of more than 40 states that have ended emergency waivers. That means patients who found out-of-state providers during the pandemic are now scrambling to find new care.
My mother suffered with mental illness for her entire life, which didn't end very well.
Wixom resident Susie Becker suffers from anxiety and depression and says many of the psychiatrists in her area treated her mother, making it difficult to find care.
When COVID hit, all of a sudden there was a chance for me to actually find a provider.
In the form of an out-of-state psychiatrist and a counselor using telehealth to provide medication and therapy.
It has gone extremely well. The problem is in July of this year, I was told that I could no longer see my counselor.
Dr. Chad Moodle, medical director of virtual care for the University of Michigan Medical Group, says that's because the waivers and license flexibility from early in the pandemic are being rolled back. Back then, virtually all states allowed providers licensed in other states to practice. Currently, only 11 states still have that flexibility, and Michigan isn't one of them.
The rules around state licensing are archaic, and the reason for that is because they were developed at a time when telehealth didn't exist.
That means providers have to pay and maintain a license in every state where they have a telehealth patient and know and comply with each state's rules.
The system is still very clunky, and ideally, you should be able to get care from your healthcare provider no matter what state you're in. And unfortunately, we're not quite there yet.
Most impacted? People seeking care in areas where there's a shortage of providers or specialists, like rural communities, people who live near state borders, and folks like Susie.
We are in a mental health provider shortage. There's no doubt about it, especially with the pandemic.
Efforts to make telehealth easier nationally and among the states have been slow. Dr. Moodle says one possible fix is to allow telehealth with bordering states, since research shows more than 60% of out-of-state telehealth visits occur in states next door. For Susie, the message is simple. Everyone should be able to get the help they need, and where that help comes from shouldn't matter.
I may be one person, but I know I'm not alone.
And of course, Susie is not alone. But insurance is a big factor in how all of this plays out. Remember, an out-of-state provider may also be out of network, and that can lead to nasty surprise bills. Now, fixing this will require work nationally and at the state level. And while few object to telehealth, right now, very few people seem to be incentivized to really solve this issue. And that leaves patients like Susie stuck searching for the help they need. Keenan Smith, 7 Action News.